I would like to introduce my co-author, Dr. Keith Darrow, and introduce the book that we wrote together. First, Keith, I want to know, would you please tell why you started writing books and why you're even interested in partnering with somebody like me to educate patients?
So I appreciate you asking me that question and for taking part in this book project with me. You know, what I learned early on, and I spent many years working with patients in the clinic, studying, the underpinnings of how we hear and how hearing impacts the brain. And I think what I realized very early was that the message about how important hearing is, maybe even more important, how important it is to address untreated hearing loss. That message is so important, and it's not out there enough. And I thought, I can be in my clinic and help, a certain number of people. You can be in your clinic and you can help people in your community, but together we can have a bigger impact on educating the 73 million adults in the United States who are living with untreated hearing loss and tinnitus. And so when this came about, I thought, what a great idea. Another community that we can help. We can help older adults who are living with hearing loss. We can help those in the middle of their life or even later stages of their life who can't hear as well, who've got that annoying ringing in their ears that you and your team are specialists at, right? I mean, you've been doing this for a long time now. And so if we can help get the word out there and get you to help more people, it's an honor to do this with you.
Thanks, Keith. I remember one of the first times that we actually met and actually got together was at a dementia certification course. And I know, like, for my family, I've got dementia on both sides. Actually, my aunt just recently passed from Alzheimer's. What got you started in the interest of dementia and actually becoming a certified instructor for dementia?
So I think, well, first off, I think that speaks volumes about you, about your team, how you every day you're testing hearing, you're treating people with hearing loss, but you learned, as I did, for about 10 years now, we have known people that are living with hearing loss are 200 to 500% at an increased risk of developing cognitive decline and dementia. And so it's very important that now that it's become part of our scope of practice within hearing healthcare, that we have an opportunity to learn about Alzheimer's disease and dementia care. And as part of that course, if you remember, I'm sure you do, we talked all about risk. Now, you mentioned genetics and in your family, and it's in my family also. Look, there's not a family, I think, that hasn't been touched by dementia. But here's what we know. About 50% of cases of cognitive decline and dementia result from genetics. But the other 50%, nearly half of all people with cognitive decline and dementia may have been able to prevent that decline. And as you know, and one of the things that we stress in this book is that treating hearing loss is the #1 modifiable factor for potentially reducing the risk of cognitive decline and dementia. So, and that's for 7 years running, right? There's like a list of 14 things you can do in your life to help reduce your risk. But #1 for 7 years has been addressing hearing loss and tinnitus.
I find it interesting. So I recently went to my primary care provider, and they had this health program. And one of the things that they really stressed and put all this emphasis was in looking at dementia and how do we prevent that. That seems to be a lot in the news. And what was interesting to me as a provider was they covered all these topics, and then they briefly had a little flash on hearing loss. I mean, I heard about how dementia is considered the 4th stage of diabetes, but yet the studies are consistently indicating that hearing loss and treating your hearing loss is the number one modifiable risk factor, and correct me if I'm wrong, but is about twice as effective as treating diabetes.
It is.
Help me understand that, Keith.
Well, look, what you're ultimately talking about, Caleb, is moving a mountain, right? And so the science it's been about the last decade. Now, in terms of the way the medical field works, the adoption of the, American Medical Association, the insurance companies, those things take time. But the word is spreading, right? Just the fact that at that dementia course they even mentioned hearing, I think is a big deal, because a couple of years ago, everybody thinks it's diet, exercise, sleep, lose weight, address diabetes, and of course, all of these things are important. So nobody's saying not to do them, right? We're not here saying that.
Yeah.
But if you're going to do anything, I always suggest starting with treating your hearing loss. And I think it's about accepting the notion that as you get older, you are going to have hearing loss and you're going to have tinnitus. It's almost a fact of life. It's part of our genetic makeup as mammals, that as we age, we lose our hearing. And so imagine if you were proactive around 50, 55, and you said, you know what, I've got some little bit of ringing in my ears, and I don't hear at restaurants the way I used to. Imagine if at that point you said, I'm gonna go get this checked, and you started treating your hearing loss and tinnitus. Well, you're well on your way to doing everything you can to potentially dramatically reduce your risk of cognitive decline and dementia.
There's something I've been dying to know.
Okay.
Well, maybe not dying, but why does earwax taste so horrible?
I've tried many samples over the years, and I've yet to quite figure out exactly what that ingredient is.
The curse of an audiologist,
we're
right?
kidding. Do not eat earwax, okay? Please do not. But if you are one of those people, we typically refer to them as wax factories. If you're one of those people, absolutely come in. Dr. Parsons and his team, they'll get that wax out. Look, but here's the real truth when it comes to wax. A lot of people think it's wax that's causing their hearing loss, right? We see this almost every day. Where somebody says, I hear fine, I'm just clogged up with wax. And what happens? We look in and there's no wax. Maybe there's a little bit of wax. I think that speaks to the notion of we're all in a little bit of denial. We all believe, no, it's not me. It's the restaurant is too loud.
Yeah.
It's my grandkids, right? My nieces, my nephews, who you've put right on the front of your book, that they all mumble. I hear just fine. But those are actually some of the early signs of hearing loss. It's probably not the wax. If it is, we'll take it out. It's probably not, ear infections or seasonal allergies. It's probably, you're at that point where once you're over 50, it's important to get your hearing checked. And if you do have hearing loss, you've got to catch it early and treat it early. Again, the number one thing you can do to maintain a healthy life until the end.
Another question, Keith, that I have is, really, the basic hearing test that most places do really hasn't changed since World War II. And there's so much technology out there, and I know that you, just as I, are a huge proponent, and as part of our message is that it should be done right. Why in the world, if hearing and background noise is one of the number one complaints, why in the world are we not even testing it at most clinics? It seems ridiculous to me. How do we get people on board? How do we get patients to know what to expect and how to have this done right?
Sure. Well, I think that's part of the confusion, and I think that's part of the stigma when it comes to treating hearing losses. They believe that they're going to go somewhere, they're going to listen to a bunch of beeps, for which nobody ever says, I can't hear beeps, right? They're going to test you, they're going to do a few beeps, you have to raise your hand, and then next thing you know, they're going to try to sell you something, right? That is retail audiology, retail hearing aids, and that's where a lot of people tend to think hearing healthcare is, but it's not, right? And so I think you hit a great point. in order to properly treat someone's hearing loss and tinnitus, you have to put them through the proper cognitive evaluation. You have to put them through the proper cognitive screening and diagnostic evaluation. And that's one of the reasons that we have partnered, right? There's a lot of practices out there who do the, dare I say, the bare minimum, right?
And what's required by the state to sell a hearing aid.
Exactly. But then there's best practices. And we've talked about this before. You have to practice not just within your license, you have to practice at the top of your license. And so one of the reasons I'm honored to work with you, to write books with you, is that Dr. Caleb Parsons and his team are always going to do everything they can. They leave no stone unturned, whether it be a cognitive screening, whether it be measuring your ability to hear in background noise, quantifying your tinnitus. The right diagnosis will get you the right treatment. There's no shortcuts.
Man, it makes a huge difference. And I'll have to tell you, I mean, it's no secret. I mean, we are voted the best clinic in the state of Idaho, multiple awards. And really, it's just because we follow best practice. I don't think it's my winning personality.
I think that's a part of it.
But it's that following best practice. And man, there are over 50,000 individuals in my area alone who need our help. And most of them don't even know it. They don't know the consequences of hearing loss, of the tinnitus, and that has become my work mission. It's why we're so passionate about it.
Well, I think you hit a really important point there, which is the truth is scary, right? And some people will say, I don't know about getting a hearing test. It's kind of a little scary. I've heard about the hearing loss and dementia. I think you just have to face the reality of untreated hearing loss. So those people that are living with hearing loss and, they acknowledge they have a problem, they've got some ringing in their ears, that can significantly increase their risk of cognitive decline. It can significantly increase their risk of a traumatic fall, right? It can significantly decrease their quality of life. It can keep them from staying in their home longer. It can end them up in the hospital. And look, I think the scariest thing is a new report that just came out this year that found untreated hearing loss increases the risk of premature death, which I found so fascinating. In the paper, they said, yet people who treat their hearing loss typically live between 4 and 6 years longer, right? That's how important it is to address hearing loss. And that's why we stress catch it early, treat it early, but you've got to undergo the right diagnostic process and the right treatment program. And I think all the 50,000 in your community are so lucky to have someone like you who is really committed to best practices when it comes to everything from educating patients to diagnosing patients and treating patients.
Keith, one of the things that we tried to do in the book is sprinkle some of those why moments. To do what we do and do it right, it takes a lot of work, a lot of effort. It's studying outside of office hours. It's a lot of work.
Yeah.
And I find that it's those wonderful why moments are what help motivate me. Why am I doing this? My favorite that just gets me every time was this young mother who came into the office. And she'd had a hearing loss for a very long time. And with her, for her fitting, when we were putting hearing aids on her for the first time, her fourth child was there in a bassinet asleep. And we fit everything up, followed the procedures. And as we're talking and she's experiencing this for the first time, well, the baby had woken up. And she pauses and she looks around and she's like, what is that noise? And I'm like, well, your baby's awake and it's cooing. And she lifts up the cover and she sees this baby making noise. And she just watches her child for a whole minute, just fascinated. And then she starts to cry. And I'm like, why are you crying? And she looks up and she says, did all my other kids do that? That is the most beautiful sound I have ever heard. Did my other children do that? And I'm like, yeah, that's normal for kids to do. And that's one that motivates me. And I wonder if you might share one of your why moments that help just give you that boost of when things are hard and you're putting all that late time in.
So I think for me, first off, that's a beautiful story, right? And there are stories like that every day. There are so many stories that are sprinkled in the book, like you mentioned. I think for me, one of the biggest motivating factors is I wake up every day and I have to think about the loss of my grandmother, right? So my grandma Mary was the life of the party. She was the one who planned everything. She was the director of fun down at her mobile home park in St. Petersburg, Florida. I mean, the most vibrant woman I knew. But when she hit about 70, things started to change. Now, I was young enough that I didn't really understand, but it was obvious to me that with every passing, say, 6 months to a year, she was getting worse and her hearing was getting worse. And it was, we were all screaming for grandma, and she had the big beige banana because this was a long time ago. But it was almost easier for her to not use it than to use it. But to make a long story short, I have to look back now and I have to ask myself, what if we knew then what we know now? What if we properly treated my grandmother's hearing loss? Maybe, we don't know, but just maybe she could have been one of those people who prevented dementia, and she could have lived to 93, which is as long as she lived, but she could have actually enjoyed the last 13 years of her life, because for us, the last 13 years was it was terrible. And she wasn't mentally with us. Physically, we had a body, but she was not cognitively there. And so I think, how many other grandmothers could be saved? How many other people could prevent cognitive decline by doing the simplest thing, which is treating their hearing loss, right? Treating hearing loss is a lot easier than losing 50 pounds, right? Yeah. It's probably a lot easier than eating healthy, than treating diabetes. It comes with no side effects whatsoever. Yeah. And so that's really one of my big motivators. Thank you for asking me that.
This brings me to another question, because I ran into something similar with my grandmother. And it's one of those professional regrets that I have, because the way I was taught, the way I was trained, my grandma just had a mild hearing loss. And the old standards is not something we would put hearing aids on. And yet, I looked at how my grandma went down with her cognitive abilities and just some of the horrible things that she went through. And I have to wonder, now I know that how much of that possibly could I have prevented? Sure. Can you please nerd out a little bit on that mild hearing loss? Because even if it's some other professional getting this message, there's harm that could have been prevented with that. Please give us some information on that.
Look, I'm going to make it really simple. It's 7 simple words, right? Mild hearing loss is a major problem, right? A mild hearing loss can double your risk of developing cognitive decline and dementia with a quote-unquote mild hearing loss. So I actually have been advocating for years that we stop using that word, because too many people think, oh, it's mild, it's not a big deal. No, it is a big deal, right? It's one of the reasons why we've been talking about, and we've even had conversations with our patients about stage 1 or early stage hearing loss, because even at that early stage, like diabetes, like cancer, like Parkinson's, the earlier you catch it and treat it, the better the prognosis. So yes, a mild hearing loss is a major problem. Now, my guess is, similar to my grandmother, back then, there was actually limitations in terms of the technology we could use to treat a mild hearing loss.
Very different.
But nowadays, you and I have people all the time who have, from a testing perspective, have quote unquote normal hearing. So they hear the beeps at a normal level, but they have difficulty hearing in background noise. Or they have some tinnitus or tinnitus in their ears, and they're having some memory issue. So we now have the technology available to treat even the mildest, if you will, of hearing loss, right? Some people have, you asked me to nerd out, so I will.
Good.
Some people have what we call a listening issue. Hearing and listening are two different things, right? So the ability to hear something is very distinct from, can you listen? Can you follow a conversation in background noise? With today's prescription hearing aid technology, we can actually prescribe that to somebody who's got pretty good hearing, but has difficulty listening and has difficulty following a conversation. I think one of the most troubling statistics that I learned, and this came out in the Alzheimer's and Dementia Journal about 2 or 3 years ago, and it said, people who have difficulty following a conversation in background noise are 60% more likely to develop dementia in the next 10 years, just from difficulty in background noise. And think about it, that's the #1 complaint of all of our patients. And so we actually live in a great time where even those people with a mild hearing loss, we can help them. We can help people with quote unquote normal hearing who have difficulty listening. Like truly, if there's an environment that you don't hear well in, that's a red flag. If you've got tinnitus, consider that your brain's check engine light. Something has to be done. And look, consider yourself blessed to be in the same community as Dr. Caleb Parson and his team. And so you've got to go and check them out and learn more about what your treatment options are. I mean, you're in great hands.
Keith, there's one more thing I want to make sure that we cover, because you and I both really focus on the medical treatment of hearing loss. It's not just communication, as important as that is, but that's how most patients and the public perceives hearing loss. We talk about it in the book about how the recommendation for updating that treatment is every 4 years. I want to hit on why that is so important and what kind of a difference that makes, because it is so critical and makes such a huge difference. So can we talk about that for a little bit?
So look, I feel like before we even explain what happens with hearing and changing your prescription, I think the simplest analogy is, and a lot of people watching this will understand, do you have glasses? And if you have glasses, you've already accepted the notion that about every 2 years, your prescription will change. And if you ask the layperson, well, why did you get a new prescription? Because my eyes got worse. Why did your eyes get worse? Because I got older. Well, guess what? Same thing happens with your ears. I will say, maybe it's a good thing that the ears change in about 4-year increments, right? So adults are told, once you start getting glasses, expect that prescription to change about every 1 to 2 years. It's our job to educate our patients that expect your prescription to change about every 3 to 4 years. Now, like glasses, although I think the advances are even bigger with prescription hearing aids, 2 things happen. Over time, your hearing will continue to get worse, albeit if you treat your hearing loss, it actually slows the process of that breakdown, from the ear to the brain and all those neural connections. While that's happening, the technology is getting better, right? And so two things are happening. Your hearing's getting worse, fact of life, and the technology is getting better. And so what science has really sort of pinpointed us is that about every 3.5 to 4 years, expect your prescription to change. Now, what we notice, and we've collected a lot of data, is that about 70% of our patients will say they hear better in background noise with new prescription technology. About 60 to 70% say that their tinnitus, they notice it's even less with the new technology. I think it's about 40% say they hear better in quiet one-on-one situations. About 20 to 30% say, you know, those loud noises like a siren or a barking dog, like you don't notice those as much. So while your hearing is changing, the prescription technology is getting better. And so, yeah, expect about every 4 years for that to happen. Look, plan on it, right?
Yeah.
You don't get to buy one hearing aid and keep that forever. The same way you don't get to buy a pair of glasses and keep that forever. It's just not the way our bodies work.
Well, and something I think it's important to kind of clarify is we can keep the hearing aid at the prescriptive levels. And when we're talking prescription technology, that's different. I mean, the technology is exploding. It's such an exciting time to be in our field.
Well, it really is. And I think, you know, the reason I'm talking about prescription hearing aid technology is because we all know it. I don't think we should ignore it, that there's now over-the-counter or what I call DIY hearing aids, right? So you can walk into almost any electronics store, pharmacy, go online, big box store, and you can buy a hearing aid. But you and I know there's never been a peer-reviewed study. There's never been an ounce of research or science that has shown buying a hearing aid off a shelf. You know, the government actually has its own category of over-the-counter hearing aids. Maybe they work for some. And if they get more people talking about hearing loss and doing something about it, I think that's great. But at the end of the day, we know prescription hearing aid technology has been proven to increase quality of life, improve cognitive performance, to reduce tinnitus, to reduce your risk of a traumatic fall, and as we've said 10 times now, reduce your risk of cognitive decline and dementia.
Yeah. It's been truly amazing to be a part of this, and so thankful that you were willing to take time to be a part of this. If it's not us educating the public, who else is going to do it?
Who will? Yeah.
So
I commend you.
Really
I really
appreciate
do.
you, Keith.
I commend you for all you do, for your team, for your community, and you got the guy.